Thank you. Good evening, or it might be good afternoon to Morocco. My name is Anne Moreira. I am the Product Manager, Blood Safety Solutions at Roche. I cover Africa. Thank you for giving me the opportunity to speak about Roche Blood Safety Solutions and how we deliver confidence in transfusion safety from donor to patient. In the next few minutes, maybe 10, I'll introduce you to Roche Blood Safety Solutions, what it means, and how you can optimize your lab operations by tapping into our solutions. Just a background on why we are here and why the Congress is happening. Blood transfusion saves lives, and WHO approximates around 138 blood and plasma donations given in a year. We know someone who needs blood transfusion, someone going through surgery, trauma, can be cancer patients. But at the same time, we know blood transfusion is very important to these patients. But at the same time, it can pose a risk to these patients through TTIs, transfusion transmissible infections. And that is why blood screening is very important for every single donation that is given to these patients everywhere. So in the next slide, at Roche, we are dedicated to helping save patients' lives by delivering efficient and reliable blood safety solutions. I will talk about in the next 2 or 3 slides about what these solutions are that can assist today and in the future. In any blood bank, we know, in any lab, we know there are so many challenges that blood lab staff encounter. There's so many demands from the partners, from the patients, from the stakeholders, and these are shortages of skilled staff. They need to be accredited. They need to go through compliance every day. Some of the times there's constrained budgets. There's strict regulations that means they should operate under strict, global manufacturing practices. At the same time, they need to release safe blood products. They maximize uptime. The instruments need not, be a downtime. They need to manage increasing workload. They need to meet new testing needs. Sometimes there are few donations. And overall, they need assays that are very sensitive and highly specific. So as Roche, we understand the need, the challenges, the needs the blood banks go through, and we are dedicated to delivering solutions that meet or cater to these needs. So as our dedication to our lab, we have been in the blood screening space since 1998. Many of you know about Roche, maybe in the HIV monitoring space, the hepatitis B, but also Roche plays in the blood screening space since 1998. And in this way, as we are dedicated to the patients and to the lab staff and the stakeholders that we have, we ensure safety of the patients, reliability of the results, and efficiency of the lab operations. How have we been delivering continuously? We deliver and are dedicated to continuous delivery of innovation. So since 1998, we've been committed to blood screening, providing very innovative assays and systems, softwares in the market. Blood safety solutions mean we are in the nucleic acid testing space, that is PCR, serology, and also automation. So since 1998, when we introduced the nucleic acid test, that is on the KABBAJ AmpliPrep and the TACMan. Most of you might be aware of this, and that we are phasing it out to give way to very innovative and higher throughput systems like the 5800, the 6800, and the 8800. We launched our MPX test, that is the multiplex test, that screens for HIV, hepatitis B, and hepatitis C in one. So in one assay, you get 3 results: HIV positive, negative, hepatitis C, and hepatitis B. This was launched in 2005, And since then, we have been launching assays, innovatively in the markets ever since. In serology, many of you might not be aware of this, but we launched our serology assays in 2012, that is 11 years ago, with our instruments, the E601, the E602. These ones have been in the market also for the IVD, for the labs. But we are dedicated to having assays that are given a go-ahead by the blood screening accreditation. We have instruments that are blood bank dedicated, that is the E411, the E601, and the E602. Also, we have the E801 for the higher throughput labs. In 2014, we launched the 688800 systems. These instruments can run up to 960 tests in a day. We launched MPX, that is, the multiplex for HIV-1, HIV-2, hepatitis B and C in 2014. And in 2019, we launched the KABBAJ. So we have solutions in serology. We have solutions in nucleic acid testing, that is PCR. We have lab automation solutions where minimizes human errors, that is pre-analytics and post-analytics. This sorts out samples for you, decaps and caps the samples for you. You have very minimal interaction of the samples. So this is what we call Roche blood safety solutions, automation, serology, and nucleic acid testing. As I said, we have all these and they're designed to work together to tailor to your needs. In serology, as I've said, I won't dwell on this so much, just to remind us of the serology instruments and the assays that we have, the nucleic acid testing, that is PCR, and the lab automation, the pre-analytics and the post-analytics. Also, we have software solutions to be able to manage your workflow. In this, as we talk about tailoring to your needs, someone can request for standalone automation where they just want the NAT or nucleic acid testing. We can offer that. Maybe one needs serology assays, we can offer that, or someone needs a connected automation where we come in and we look at how the lab is set up. You will have the pre-analytical system, the KABBAJ P612, connected to the E801, connected to the 6800 and the post-analytics via our connectivity solution called the CCM Vertical. All this is available online, and maybe you can request for information from the Morocco team where we can provide this. This is a portfolio in a single system. So for serology, most of the blood banks are looking for the basic HIV, anti-hepatitis C, hepatitis B surface antigen, and syphilis. We have this, and we also have additional serology assays like hepatitis A, hepatitis B, E antigen. We also have the hepatitis B surface antigen confirmatory, CMVs, and also for the nucleic acid tests, we have the MPX, that is hepatitis B, HIV, and hepatitis C in one. We also have the Western Nile virus, DPX for hepatitis A and parvovirus B19. We have hepatitis E, Zika, and Babesia. So this speaks to how we have invested to deliver solutions for today's needs and maybe for tomorrow's demands. We don't know what the guidelines will say a few years from now, so we are taking care of that too. I talked about how we are committed to the highest level of safety for our patients, and I want to take you through in very few minutes what that means. For safe blood, we speak to, is the assay able to cover all the genotype and mutant variants? Is the assay very sensitive, and are there manual handling steps that can cause cross-contamination? At Roche, what we offer is comprehensive coverage of the genotypes and mutant variants of all the infectious diseases. Excellent sensitivity, this is proven, and the resources can be found online. Also, we automate the sample handling processes. That's why we have the pre and post-analytic systems. How do we ensure safety by detection of genotype coverage? So for HIV, for instance, we have dual target approach for HIV1 group M, group O, and HIV2. We have dual probes for hepatitis C. I know most of the molecular scientists in the room know what dual and real-time detection means, PCR for HIV, hepatitis C, and hepatitis B. I'll not go into more Western Nile virus, hepatitis E, and B19 and hepatitis A because I know these are not the infectious agents of focus in Morocco, maybe in Central Africa Republic, but of interest, I know it would be MPX assay where you, in one single assay, you get 3 results, HIV, hepatitis C, and hepatitis B in one donation. In serology also, how we ensure comprehensive genotype coverage. You know, we have excellent analytical sensitivity. We are the market leaders for IVD. We have best in the class seroconversion when it comes to hepatitis C. That is usually an issue, I know, in blood banks. You know, there is false positives for hepatitis C. So we are best in class, you know, according to studies and competitors. Also, we have unique triple antigen assay design for cutoff. This is for HIV duo, antigen, and antibody in one. The second one where we are a dedicated partner is that we ensure reliability of the results. And how do we do this? So for your results to be reliable, they need to be released in a timely manner. You need to have confidence in your results and also assurance in the service. And at Roche, we optimize uptime. We have contamination controls and validated workflows and also skilled local support. We have a Morocco office, which ensures that all the instruments are, we have dedicated field service engineers, application specialists. We have an entire team in the country to ensure that the uptime of the instruments is met. So you have less interaction of services, troubleshooting, and you are more productive and predictable turnaround time. When it comes to confidence in results and validated workflows, ours is an end-to-end blood safety solutions, where you have the pre-analytics, the analytics, and the post-analytics all in one. And this is to note that our systems, especially both the NAT and serology, we have the disposable tips across those systems. This ensures that single tip, it's not washed and repeated. It is used and disposed. Maybe other providers can do the washing, but you cannot be too sure about the washing. We have done cross-contamination studies on the pre-analytic systems, and all this can be found online. In the total of the 832 samples that were tested, of these 208 were hepatitis B high titer, and 624 negative samples per workflow. So the negative samples were tested on the 688800 system, and the result was 0 cross-contamination detected. When you use a single tip, when you use one tip, it's not repeated. So this minimizes risk of cross-contamination and ensures confidence in results for both our systems. And lastly, our key pillar when it comes to dedication is ensuring that there's efficiency in the lab workflow. And how do we do this? We reduce retesting. Retesting, this keeps on wasting time. You have to keep on retesting. Also, it minimizes loss of donations because you're not sure, is this a false positive or a true positive? Efficient use of staff, I'll show you how this is, and pressure to do more with less. In how we reduce retesting, our assays are of very high sensitivity. Also, fully automated analyzers up to 8 hours walk-away time. For the 6800, you just load your samples and then you leave them. 4 hours for the 6800 and up to 6 hours for the E801. Then the staff is freed to do other activities. So you realize staff shortage is covered in that. So as Roche, maybe I'll mention, I was asked to mention where our solutions are in Africa. In Europe, we are in Germany, we are in Switzerland, we are in Greece, both serology and NAT. In Africa, we have serology solutions in South Africa, the E801. We have the nucleic acid testing in Uganda. And most of you can look up how the Uganda story, this has been discussed in the Africa Society for Blood Transfusion. also in Egypt, where they test every donation with nucleic acid testing, that's PCR. So that is how we deliver confidence in transfusion safety from donor to patient, by dedicating our expertise in ensuring safety, reliability, and efficiency. Thank you very much for listening to me. And if you have questions, the team is ready and willing to answer them. Thank you.